Hi everyone, Dr. Jeff back with this week. Hopefully people enjoy some of the shoveling. If you're a little sore, you can book with us. Come on in, we'll fix you up. But this week we're talking about what?
Today we are going to be talking about the reflexes, all things reflexes. And what reflexes are is a way we can test the condition of the nervous system.
Reflex is involuntary, so it's automatic. So it doesn't really get a chance to go up to your brain. So it's like you have a little mini computer in your spinal cord at your spinal level. So what happens for the reflex is he goes in to the spinal cord and does a little roundabout and comes straight back out again. It's very, very quick. That's why it's called a reflex. Your brain doesn't really know what's happening until later. But it's very, very quick, and it can be kind of a protective mechanism for the body.
Okay, so we want to talk about 3 different reflexes. I'll kick us off with the first one, being the motor reflexes. And so these are classic reflex tests that you'll see the doctors doing, right? So that's going to be something on the patella, right? They strike your patella and your leg kicks up, or at the bicep. And so these are ones, you'll commonly see at the doctor's office.
Yeah, the next one we're going to talk about is superficial. And one reason we're testing reflexes is all your reflexes are linked with a certain nerve. So, as you mentioned, the patellar reflex, that's going to be your L4 nerve root. If your bicep, it's your C5, it's your Achilles, it's going to be L5. Superficial are not quite as dramatic. These ones here are more of just a stroke. So we kind of just stroke along your abdomen. We're looking how the belly button kind of reacts and how your skin reacts up in your shoulder blade, looking at how your shoulder might react to that. There's different ones we do called superficial reflexes. Again, they're linked to different nerves in the body, so we can kind of test different nerves doing those ones.
And then the final one would be also a common reflex that you use every day, maybe without knowing it, but you touch a hot flame and naturally your hand's going to withdraw. And so that's a protective mechanism that the body has, and something we would deem a reflex as well.
Yeah, they're so quick that you never know you're doing it. The brain doesn't get a chance to react because it's a little roundabout in the spinal cord, and your body automatically has learned how to do that.
Yeah, so now we want to kind of give it a whirl and test one another's reflexes.
Yeah.
See what that looks like. All right, everybody. We'll start with Dr. Jeff. We're going to do his right leg first, and this is the patellar reflex demonstration.
All right, so I'm going to close my eyes and just relax.
And make sure to watch your head, because he might kick up. Yeah, that's a pretty good reflex right there. We'll test the other leg too, because like we mentioned, you want it to be bilateral. Oh, I kind of missed a little bit. There we go. Yeah. So he's responsive. The knees are working, people.
Wow, we don't really have a lot of happening with her compared to me. So one way we can go about this, we're going to have her close her eyes. She's going to put her hands together and try and pull her hands apart to try and make her brain think of something else. And there's still really not much happening there. If I go down to her Achilles, at least, oh, there you go. Yeah, I got a little bit of a push down the Achilles. So the big thing important is it's the same on both sides. So with if I got a reflex of 2+ on the right but nothing on the left, that would tell me that there's probably an L4 impingement somewhere along the track of the L4 nerve root. But because it's the same on both sides, we're not going to worry about it. I hope everybody enjoyed our reflex demonstration today.
Yeah.
Something you always play with at home. Don't remember playing doctor when you're a kid and doing stuff like that. But reflexes are a good way for us to test your nervous system. If you have any questions about anything we talked about today, you can always send us a message, give us a call. Always give us a like for our videos. If we get 10 likes, I'm going to wear special socks again. But anyways, here at Goals of the Wellness,
we got your back.